All right, so this lecture relates to the discussion of what is disease. The next sections in the class are going to have to do with the parts of sexuality that have been defined as pathological, as disease state, as so out of bounds, so strange, or so harmful that we consider them a disease. So let's try to define what normal is. So again, relative to the discussion post was about this, but why is it important to agree on a disease definition? There's at least a couple of reasons, but one thing you ought to know if this question gets asked of you is that in part, what we define as a disease helps us figure out how to allocate resources for that disease. So if it's not, and in general, in Denmark and in the States, if something doesn't get a diagnosis, it isn't entitled to treatment, either through your insurance or the public health system. So that's an important reason, is the allocation of resources. Also, what's important is that clinicians use disease states or use disease language to communicate. So when one doctor tells another doctor this person has sickle cell anemia, that is shorthand for a set of treatments and a set of symptoms that the new doctor can then use to treat the person. So again, related to the discussion post, there are various problems in defining diseases, and most of you all got these in the discussion post. But one is that the definition of diseases varies immensely across cultures. There was one piece of information that showed that there were no eating disorders diagnosed. It was in an African country, I can't remember which one, but not until the DSM came there did they start spotting eating disorders. So different cultures define problems in different kinds of ways, and as you saw in the reading, it also varies across time. For example, a great example is homosexuality was defined as a disease from the Victorian age up until about 1973 or 1974, and then it was removed as a disease. So it varies over time. Also, medical advances impact what's considered a disease. So as we have new medical advances, things are sometimes removed from the disease category or added to a disease category. And by the way, in the DSM-5, the number of diseases has ballooned. It's some sort of an exponential ballooning over the years, where there used to only be a few, and now there's several hundred. So it almost never really goes down, the number of diseases. It almost always goes up. And then the last thing, and the most nefarious perhaps, is that drug companies have an influence. They sponsor a lot of research, and they deliberately, probably you could say, try to influence what gets focused so that they can sell medication. And this, some of the laws about this have changed in the United States. They're quite different in Denmark. But it used to be in the States that drug companies would go around to doctors' offices and give them all sorts of freebies. What do you call it? Gear, swag, if you will, to say, why don't you prescribe our drugs? So they would, and there was research that it really did influence the doctors and the drugs that they prescribed, and also in the diseases that were diagnosed. They've regulated that now to where the drug companies can't pander so much to the doctors. That it's still controversial because a lot of times what drug companies do is they'll give away free medicine. And so then the doctor diagnoses the disease that medicine treats more often. But the controversy is that we need them to give away, especially in the States, we need them to give away free medicine because medication is privately paid for. So poor people need the free meds. So it really is a sort of vicious circle of drug companies having influence on what gets defined as a disease. So I'm going to tell you a little story about diagnosis that happened since I've been practicing, and it happened in the early 1990s or late 80s, early 90s. And this picture that you're looking right here is drawn by a client who claimed to be a victim of satanic ritual abuse. This was called satanic panic. It's and it's an example of what's known as social contagion, the phenomenon whereby diseases have a social component, whereas when people hear about them, they're more likely to have symptoms and to report symptoms. At any rate, here's what happened. It started in the Rocky Mountain West in the U.S. with a few clinicians who were seeing clients that had a certain kinds of set of symptoms. Often they had what was called multiple personality disorder. That disorder no longer exists. It's called dissociative identity disorder now. But at the time it was called that. And these folks, they often also had comorbid diagnosis with borderline personality disorder and post-traumatic stress disorder. But they were telling, and some of these folks were in group therapies together, and they were telling similar kinds of stories. They would say things like, my parents, when I was young, would have a seance in the basement of our house. The neighbors would come over, they'd dress in black, they'd wear horns or have robes, and they would make a sacrifice, either an animal sacrifice or a human sacrifice, and then they would have sex with the kids. This was immensely troubling when people reported this. And it spread over the Rocky Mountain West. And actually, there were cases in Europe as well that came after that. Now, since then, what ended up happening, and partly some of these clients had been hypnotized, and they would talk about these killings and the sexual abuse. So some of the clinicians reported these things to the police, and here what happened afterwards was that sometimes the police would go to the childhood home, look in the place where the body was supposedly buried, and there was just never anything found to substantiate it. And what they found later, after some clients recanted their stories, and after there was just zero data to find this, is that most of these things, they were suggested or made up by the clients. And it could be that perhaps the clients didn't consciously make them up, but they were trying to please their therapist while under hypnosis. Interestingly, years later, I was at a hospital treating some patients, and I hadn't heard anything about satanic sexual abuse for 15 years by that time. And I got the patient came in and reported satanic sexual abuse. She and her therapist never got the memo. It was very strange to treat this person, but what happened was she'd been with the same therapist, and it was from the Rocky Mountain West, and she'd been with the same therapist for 20 years, and they just always sort of worked with this assumption that she'd been satanically ritually abused. At this point, you can't say, no, that didn't really happen, none of those were substantiated, this was probably part of the satanic panic. You have to treat her like it's the truth. And at any rate, crazy situation. So none of these were verified, and there was a lot of people recanted, and now when we look back, it is evidence for social contagion. This is the phenomenon, whereas people, when they hear about a diagnosis, they start to feel like they have symptoms of it. It's a particular kind of person that does this, by the way. It usually has some histrionic components to them. This is the same thing I was talking about some autistic kids perhaps hearing about the transgender, and there's some concern that for some kids with autism that happens. Not for every trans case. It's the same word I used back then, social contagion. So why did this happen? And by the way, here is the book that was written at the time by Michelle Smith and her doctor that she married, Lawrence Pasder. I don't know why doctors would marry their patients, but they did back then. And it's her story of satanic sexual abuse, and it was called Michelle Remembers. It was written in 1980. Again, it's been pretty much debunked by now, but they think some of the things that led to this satanic panic. First of all, the laws changed. Now, what happened was many states in the U.S. started adopting mandatory reporting laws. Those are laws that state that if you have any suspicion of sexual abuse, you have to report it if you're a clinician, even if it's told to you under confidentiality rules. So you start to see more therapists think, oh crap, I have to tell the authorities. And maybe even fishing for it, you could argue. In the forensic realm, there were new ways of interrogating children that came about. They started asking children about sexual abuse using these anatomically correct dolls at the time. It used to be that they just reported, if a child said they did it, that was the evidence of it. But then they actually started interviewing kids, and they'd point to a body part and they'd say, did your dad touch you there? And they would take a yes as an affirmative. Again, we since found that kids will often say yes, even if it's not happened. And what they found in one study they did is that 100% of the kids said yes, even when it didn't happen. So you can sort of lead, and there's a lot more science now behind how we interrogate kids. And therapists aren't allowed to interrogate kids, by the way. And you could even corrupt their testimony. In other words, if you ask them these questions while they're in your office, you can make it to where you can taint their testimony to where they can never testify in court. Another thing that was happening at this time that I think is pretty fascinating is we started to use hypnosis as a means of detecting the truth. And this is an inappropriate use of hypnosis. Hypnosis has some uses, but you cannot determine that something that someone says under hypnosis is a fact. And there's been a lot of studies that have shown this. More personally, I had a professor back in the 80s he's died since then, but he was in the Nazi prison camps. He stayed alive because he was able to hypnotize people. The Nazis kept him alive because they would have him hypnotize Allied generals and things like that, and to try to get him to give off top secret information. And what this guy found is even when he hypnotized the generals, that they lied, even while under hypnosis. So it's not a fact that people tell the truth when they're hypnotized. And the last thing that they think contributes to this phenomenon, this satanic panic, was what it's a countertransference, and I'm going to call it therapist fascination. It is possible when you're listening to somebody to make them think you are so fascinated with what they say that you increase the odds that they're going to say more of that. For example, if I'm a therapist and a client's talking to me in a certain way and I'm nodding and I'm smiling, they're more likely to go on with what it is they're saying. And they think that when therapists would get these stories in the office, they would give so many nonverbals and they'd be so fascinated with their client that their client was encouraged to confabulate, to make up stuff, either consciously or unconsciously, in order to please or fascinate their therapists. This is a countertransference phenomenon, and it's a good reason why we should not use what clients say in the therapy session as data, because it's not the same as a forensic interview. And forensic interviews are designed to not lead the person into saying something. We therapists, unconsciously, we also encourage our clients to say stuff or discourage them to say things.